Hello, I'm Dr. Greene, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. What I'd like to talk to you about today is the natural course of lumbar disc herniation. Lumbar disc herniation, the incidence in this country is 1%, which is actually a very large amount when you think about it. The population of this country is over 300 million people. So at any point in time, there's a few million people who are suffering from a herniated disc. A herniated disc can be an extremely painful phenomenon. The discs are the squishy parts that are between the bony elements of our spine, and I liken it to a jelly donut, where if part of the jelly squeezes out from the donut and it pushes on a nerve root, it can stir up inflammation and cause pain that shoots down your leg. It can cause some back pain as well, but typically the pain shoots down the leg and it can be debilitating. Pain, it can cause numbness and tingling, and it can also cause muscular weakness. If that's the case, then it becomes more of an indication for surgery. In the vast majority of cases, or at least in the majority of cases, surgery is never indicated. The disc, the piece of jelly that has squeezed out from the donut and is pushing on the nerve root, it typically will disintegrate and will become not so painful. The pain that goes down the leg will go away. The studies that have been done looking at whether to have surgery or not for lumbar disc herniation, unless you have muscle weakness, if it's simply pain and numbness, the natural course of history is that at 1 year, patients do just as well without surgery as if they went and had surgery. Now, if you have surgery for a herniated disc, which is called a lumbar discectomy, it typically is about an hour or so surgery, depending on where the disc herniation is or whatnot. And patients go home either same day or the next day, usually. The results are no different at a year, what the studies show. Patients get back to work faster, they get out of pain faster. However, if a patient undergoes conservative treatment and can keep their pain at bay while you're waiting for your body to disintegrate the piece of disc that is pushed out and is pushing on the nerve root, then the result may be the same, and you've avoided surgery with the cost and the potential complications associated with it. At Preferred Pain Center, we have a comprehensive pain management selection of options that our medical providers offer. This includes physiotherapy, rehab, spinal decompression, which can be extremely effective for disc herniation, interventional pain management such as epidural steroid injections, pain medication, and also chiropractic treatment. These things may be able to keep your pain at bay. You may be able to continue to work, play with your kids, socialize, while allowing the natural course of history, which is typically that the disc disintegrates that piece and then comes off pressure off the nerve root. Now, if you start to have muscle weakness, or if the pain is debilitating and lasts more than 6 to 8 weeks, then surgery may be in the cards for you. That's either a quality of life decision, or if you have muscular weakness, then surgery is indicated to try and reverse that muscular weakness, and that may be what's needed for you. So at any rate, that's the natural course of history of lumbar disc herniations. I'm Dr. Greene, CEO of Preferred Pain Center. If you or a loved one or a friend is suffering from a herniated disc with sciatica or in the neck with pain down the arm, give us a call. I'm pretty sure we can help you. Over 98% of patients we've had extremely good outcomes with. Our number is 602-507-6550. Also visit us on the web at www.preferredpaincenter.com. Thank you very much. Preferred Pain Center, the pain stops here.